Welcome to Health and Wellbeing Live, sharing knowledge and experience from Nottingham City, keeping people informed about the issues, people, services that are supporting health and wellbeing in the city of Nottingham. This is a relaxed podcast style production pitched at interested and informed audience. There's little dumbing down, and we're aiming to have a deep conversation about issues that matter for health and wellbeing in the city. But this is open to anyone to listen to, so welcome. Today, we're talking to David Johns, who is the Deputy Director of Public Health in Nottingham City. And just for people's information, I'm Dr. Andy Foster. I'm a GP. I work at NCGPA as a director on the board, and I work at PLACE and in PCN on health inequalities. So welcome, David.
Cheers, thanks very much, Andy.
Good. And yeah, David, do you want to introduce yourself and just tell us a little bit about your current role?
Yeah, sure. So I'm Deputy Director of Public Health at Nottingham City Council. So I have a portfolio around health improvement. So that covers a range of different areas, from our children and young people services, including health visiting, through to eating and moving for good health. And I work on obesity, both in children and in adults, as well as all the way up to working with older people in dementia and tackling those topics with colleagues in the ICS. And obviously, one of my areas of focus is on smoking and tobacco, which we're talking about today. Absolutely.
Yeah, you're right to highlight that's the main focus of today. There's lots of areas that we could focus about in terms of public health priorities for the city, but that's the focus for today. So David, when we were talking before the episode, I was sort of making the assumption that you were probably a medical doctor who works in public health, but that might not be the case, as you're explaining. Actually, there's varied entry points into public health. So how did you arrive at your current role?
Yeah, so I've a lot of people in public health come from very different backgrounds into the profession. So I started off doing an undergraduate degree and becoming a registered dietitian. And then I moved from that into the world of research and academia, and did a PhD in Cambridge on nutritional epidemiology before doing a postdoc, and then deciding actually I needed a change, something different, something closer to policy, closer to sort of being able to change things to benefit people's health. And so I entered the public health specialist training program, and it's one of the training programs that is opened up not just to medics, but open now up to non-medics as well. And so we joined that program 5 years, rotating around the East Midlands in various different local authorities, and Public Health England, as it was when I did my placements there, and working with various different partners from across the system. And then that ended up working in Nottingham City as a consultant, and then progressing up to where I am now as Deputy Director of Public Health.
What sort of team have you got kind of around, or we won't say sort of beneath you, but in terms of public health in Nottingham City? What does the department look like?
Yeah, so we have obviously Lucy Hubber, who's our Director of Public Health, and then alongside myself there are a number of other consultants in public health who have their own portfolios. We have Helen Johnston, who does inclusion health, and we have Dana and Liz, who do work on our data and intelligence functions, and how we sort of progress public health intelligence, as well as our community focus and how we interact with the ICS and how we build a strong community foundation for our public health work.
Yeah, great. Okay, great, thanks. And so we're talking today about smoking and tobacco, but I gather that will fit into a kind of wider set of priorities for health and wellbeing in Nottingham. So yeah, how does smoking sit alongside other priorities at the moment, David?
Yeah, so we have published our joint health and wellbeing strategy a couple of years ago now, and there are a number of priorities that were identified in that based on looking at the health of our population, what's really driving some of those differences in health amongst people in our region. And so we know that smoking and tobacco obviously is a primary cause of poor health and illness in the city, but also eating and moving for good health. We have really high childhood obesity rates, and we have sort of work to do in that particular area. Severe multiple disadvantage is another key area that's highlighted within the Joint Health and Wellbeing Strategy, as is financial wellbeing, which obviously all realise is a big issue for many of our residents at the moment, and looking at how that interacts with health and how we can sort of support our residents through that. So it's one of those core elements of our Joint Health and Wellbeing Strategy that are the priorities for the city at the moment in terms of health focus.
Yeah, no, that's good. That sounds like a good set of priorities. I mean, I'm just thinking about the differences I see where I work in Bulwell in terms of what I see on the streets in the consulting room compared to, maybe near where I live in, say, West Bridges, very different areas. And I think those differences are really visible just on the streets in terms of rates of smoking, the physical activity that people are either doing or that they look like they do in terms of how they look physically, and all of those other socioeconomic factors as well. Okay, it's interesting. But I guess, go on, David.
No, I was just going to say, you've landed on exactly the point of the health and wellbeing strategy, which is it's not just about interventions and things you can do. The health and wellbeing strategy that we have in the city is all about those wider determinant factors, those things that influence our health that are broader, and we need to take action at a system level or change the environment around us to have an impact.
Yeah, they're good. And I guess particularly today, we're here to talk about smoking and tobacco. How much of a problem is smoking, tobacco, and the related problems that people can develop in Nottingham City, say, as compared to other areas nationally?
Yeah, so smoking is our single largest cause of preventable death and disease in Nottingham, and it has been for more than 20 years. Now, that doesn't differ greatly to what you see across other parts of England, but we do have just over 1 in 5 of our residents who are adults in the city who smoke, and that's significantly higher than you see across England as an average. Around about 12% of the population generally smoke, but we're up at 21%, and that really puts us as the second highest rate of smoking in England at the moment. So it's it really is a priority for us, and we are one of those areas in England that needs to sort of take a focus on this.
Gosh, and I was asking you again before the call. I was saying, is there any kind of demographic insights into smoking in Nottingham City? Is it particular ages, populations, ethnic groups? I mean, what do we know about smoking in Nottingham City?
Yeah, so a lot of our data comes from national surveys and national data, which means that some of that breakdown has been hard to come by. And I know we're doing work because I know that in GP practices you collect a lot of data, send out a lot of requests to your patients to gather information about smoking, and so we're starting work to think about how we can utilise some of that data to find out that information that you go, what's the characteristics in Nottingham as opposed to the rest of the UK. What you do see is some stark inequalities in smoking. Smoking drives health inequalities in itself, but you see those inequalities in terms of those residents who are living in areas of high deprivation, who have less resources, tend to smoke more, and that tends to drive some of their ill health and some of the health inequalities that we see in those populations and those communities. So that makes sort of a real big difference. And then there are small pockets of other areas of focus. Smoking and pregnancy for us in the city is a particular area of focus as well, because we, as you'd expect from having high rates of smoking, we also have high rates of smoking in pregnancy, and that has obviously a knock-on right from birth for the next generation. So it's a real focus of attention for us as well.
Absolutely. I'm just thinking about the inequalities that you mentioned. So we had some local smoking data for us in Bulwell and Top Valley Primary Care Network, and I think our smoking rate was about 25%, just under 25%. So, we're probably a more deprived part of Nottingham City, which in itself is quite deprived compared to other areas, and we have sort of the highest rates. So that's interesting and kind of follows that pattern.
Yeah. Definitely, there's definite variation within the city boundary, and you do get pockets where we're talking about 21% being high in relation to England, but in parts of the city you can get a third of residents living inside certain PCNs that may be smoking.
Absolutely, yeah, and just making me think about the the effects I see of smoking, because we all know and I'm sure everybody listening and watching, knows that smoking is detrimental to health. But I'm just thinking about what I see in my area, and you may make some observations when you're trying to, do work with people who smoke. But just that accelerated general aging, that you see with people who've smoked for multiple decades compared to people who haven't. It's just really obvious. You can spot the smokers after a few decades, and then obviously people have specific problems with respiratory illness, emphysema, COPD, earlier cardiovascular disease, so that's your heart attacks and your strokes happening earlier, robbing people of time with their grandchildren, what should be quite enjoyable times of life. People losing limbs, peripheral vascular disease. You still see a lot of that happening. It's really quite tragic. So it really is an important issue.
Yeah, and so many people start, the generation that you see who's smoking now they won't have started, well, the majority of them won't have started smoking as adults. They'll have started smoking as children. And I think the important thing to remember is that, it's an addictive habit that people are trying to fight against, and it is a challenge for people to take action.
Yeah. So David, I was going to ask you next, kind of what have we been trying in the past, as a city or as a country, in terms of supporting people stopping smoking or preventing people from smoking in the first place? And where are we going in the future, in terms of smoking and tobacco control in the city or nationally? But where have we come from? Talk us through that journey.
Yeah, I think we've long had a focus on smoking and tobacco in different guises over the years, and before I was working in Nottingham, I know that there's been lots of work on various different stop smoking services that have had presences in Nottingham and supported adults in Nottingham to quit smoking. That continues at the moment. We have the GP Alliance and Stubbit service that supports our residents and anyone aged 12 and above who smokes and wants help quitting. They're there to support that. We've also had pockets of activity in other areas, and the one thing that we did as part of our joint health and wellbeing strategy, focus on smoking and tobacco, was start reviewing where we've had successes, where we've had gaps in our provision in the past, and thinking about how we can work with communities around smoke-free spaces to build those more into our lives, how we can work with children and young people, how we can keep supporting more focused attempts around quitting smoking and engaging with people so that they take up that offer. So lots of coordinated activity, and I think that's the difference that we're trying to take forward into the future, is forming a Nottingham and Nottinghamshire Smoking and Tobacco Alliance. Brings together a range of partners to coordinate what has been lots of pockets of action in the past, but now looking at it in a coordinated way about how do they all play their role in the sort of jigsaw piece and jigsaw puzzle that we're trying to create around smoking.
Yeah, so I can see for those people listening, David has a nice background with the Nottinghamshire Smoking and Tobacco Alliance logo, which I think is a new thing. It's not something that I've seen around for a long period of time. I was just wondering who is in the alliance, who are the partners, and what are the potential benefits of that kind of partnership approach, David?
Yeah, so the Nottinghamshire Smoking and Tobacco Alliance brings together so two local authorities. So you've got Nottingham City Council and Nottinghamshire County Council, the hospitals across Nottingham and Nottinghamshire, fire service, police, and a range of other important community partners. We've got colleagues from the locality teams linked to PCNs involved and linking us into GP practices to get information both two ways around that from the Alliance. So all sitting around the table together with a collective vision to create a smoke-free future for Nottingham City. So the aim would be by 2035, we see less than 5% of the population smoking, which is a big journey for us to go on, but a really important one to achieve.
Yeah, it's quite ambitious actually, but it feels like this is the first time I've heard about all of those partners being around the same table with a shared specific smart goal. Am I wrong in thinking this is new or different to what's happened before?
There have been in the past a variation of the current Smoking Tobacco Alliance has existed, and had some discussions about tobacco and tried to bring partners together. I suppose this time we've taken the time to get people around the table to come up with that shared vision of what we're all interested in achieving, and how we're all going to play our different roles and parts, so everyone knows their role in the broader alliance. And with the alliance as it is now being relaunched, there's a really clear target for what we're trying to achieve, and everyone knows that there's something they can do to support us in achieving that target. I think that's the thing that will drive us forward and to take sort of positive action.
That's great. And what are the main sort of areas or components of the strategy that the alliance will be taking forwards? What are you going to be focusing on, or what are you going to be doing to try and tackle smoking?
Yeah, so there's 4 key areas that the alliance has identified that it's going to focus on. So ensuring children and young people are aware of the dangers of smoking, and have their skills and confidence to say no. Looking at tackling the illegal sale of tobacco and vaping products to those who are under 18 years of age, and tackling any illicit tobacco that might be present in the local system. Thinking about how we explore those opportunities to increase the number of smoke-free spaces outdoors that people in Nottingham sort of come into contact with, and then also reducing those harms to people who do smoke. How can we support people who are smoking to think about that journey of how they become a non-smoker or an ex-smoker?
Okay, that's great. I'll probably take each one of those in turn, David, and just ask for what we might expect around each one. Taking children and young people first, and actually I was going to ask a little bit more about vaping, because everybody out there, including the clinicians, will wonder actually what should we be, where does vaping fit into this? Because there's obviously a lot of concern about younger people vaping, and using vaping products, but also vaping is promoted to older smokers as a means to support them in transitioning away from cigarettes. So it feels like, particularly to the population, there's somewhat mixed messages going out now about vaping.
Yeah.
Do you have anything from a public health perspective that you can say to clarify that around vaping?
Yeah, so I think vaping is obviously a very hot topic at the moment. Excuse me. The Alliance has aligned itself with, so the Directors of Public Health from across the East Midlands have come together and had those discussions so that we're all on the same page about what our position on vaping is. And I think it's really clear that absolutely do not want children vaping at all, because there's that danger that they can become addicted to it, and there's those potential harms and damage to our hearts and other consequences that may come from vaping. Vapes really exist to help smokers who find it difficult to quit find that alternative to reduce the harms of smoking. Smoking is terrible for you. We've discussed some of the complications about what the problems with smoking can cause, and the comparison with smoking sets a pretty low bar. Vaping is much better than smoking for your health, and if you are looking to reduce the harms that smoking can cause, switching from smoking to vapes is a positive move that you can take. But that bar is low. That doesn't mean that vapes are therefore risk-free and harm-free. Therefore, if you're not smoking, there is no reason why you should be thinking about taking a vape, because it is something that is a harm to health potentially. Yeah,
that's really helpful clarification. So I guess if you're currently smoking, well, switching to vapes is probably better than smoking. In fact, almost certainly. But if you're not inhaling nicotine products at all, then we don't really know the harms of vaping, and they're not going to be zero. So there's really no good reason to start doing it. No, absolutely, David. Anything else in particular that's happening on that children and young people thread within the strategy?
Yeah, so both in the city and the county, we've got an offer to schools within the city, a free offer of a service that helps them integrate conversations about smoking and tobacco and the tobacco industry into classrooms, have a discussion about how some of those tobacco industries have tried to influence the behaviour of our population in the past, Nottingham has a strong history with the tobacco industry, and we've seen when I came to Nottingham, lots of stories were told to me about how people used to get bonuses from working in the tobacco industry paid in cigarettes and other issues like that. So we have a long and steep history in Nottingham with the tobacco industry, and educating people about that, but also thinking about what's their next step. If they're going to be offered a cigarette, how do they keep that resolve to say no and maintain that resolve? And the program is called Intent, largely because it helps students state their intention to not smoke and to say no when that sort of opportunity might present itself, and gives them the tools that they need to carry that out in practice if it ever does arise.
Yeah, so all of that feels like familiar ground for some of the clinicians out there. The next area was tackling illegal sales of tobacco, which is not something the clinical part of our audience will have been thinking about very much, but it's quite logical how that fits in with the strategy. What might we see happening around that issue?
Yeah, so public health is working with the trading standards team within Nottingham City Council, and also working with the police on a joint venture to create a illicit tobacco task force in the city. We already, within our trading standards team, have resources to go out and tackle illicit tobacco, and to run spot checks to understand if anyone is selling underage products to underage customers. But what we're looking to do is invest in that, to put some specific resource, part-time police officer alongside trading standards people, to form a task force to go out into communities to tackle this issue. I think it's a really important one, in that we know that there are people out there who are 18 and under who smoke and who use vapes, and yet it is illegal for them to buy both under the age of 18. So we know there's an issue out there that we need to solve, and it's important to get to grips with.
Yeah, and I think also people often, tobacco products are quite expensive, and I know at times I've spoken to patients who get their cigarettes from other means, smuggled in, goodness knows where, that are cheaper. Yeah. So I see how that's also an issue as well. The other thing that we saw in the news recently was proposals to increase the age at which it is legal to buy cigarettes and tobacco products progressively by 1 year every year, such that I think people who are currently 14 would never be able to buy a cigarette legally, which is an interesting big development. I don't know how you feel about that, and how plausible you feel that might be, having talked to the partners on this issue.
Yeah, so I think it's a really positive step. There was a independent review of smoking tobacco done at a national level, and this is one of the things that they suggested should happen and should be taken forward. So it's nice to see that we're taking steps to make it a reality. It's very much a workable policy. In the past, we've increased the age of sale for tobacco, and we've seen big decreases in the smoking rates amongst those populations. This is a next step to continue doing that. And our trading standards and colleagues in police will work with us to figure out how we monitor that as those stages progress, as those age increases, to make sure that we continue to tackle the sale of tobacco to underage customers. And I think what we'll see is that over time, the desire to even sell tobacco becomes slightly less, because actually, having to ID people will become less and less of an issue, because actually there will be fewer and fewer smokers out there considering it. And I think that's the key goal, is that people take up smoking at a young age, and it is an addictive habit. And we need to recognise that actually, if we can tackle that at an early age, then it has a lifelong benefit for their health.
Absolutely. You're also mentioning smoke-free spaces and harm from secondhand smoke, and I was presumably we're talking about sort of outdoor spaces here, because most indoor spaces are smoke-free, where it's an environment where anybody could be employed, because of secondhand smoke legislation that's been around for some time. So, what sort of spaces are we talking about, and how do you make somewhere smoke-free? Is that enforceable? How does that work?
Yeah, so there isn't much legislation that gives us scope to designate this will be a smoke-free space and it's illegal to smoke within this space. But what there are sort of some powers and variations around littering and other things that could potentially be used. But really, our focus is on actually that personal responsibility, that peer group, and that looking at the population, go, how can we hold each other to account for smoking? And we've already in the city got smoke-free areas. We might not realise it, but they exist. So when we have the Christmas market or when we have the summer beach, both of those are designated as smoke-free areas, smoke-free events, with lots of signage designed by local children from around Nottingham City, calling for people to not smoke inside the boundary of that event, inside Market Square when those events occur. And similarly in our playgrounds around the city, we have clear signage around not smoking around those playgrounds. I think the future of the smoke-free movement is still sort of to be decided. And we're working, we've commissioned some surveys to start having conversations with the communities to understand what their view is. And largely people are really positive about the idea of having more smoke-free spaces. And many of that is focused around how can we work with community groups. So how can we work with sports clubs, local sports clubs and children's sports clubs to think about having smoke-free touchlines so that you don't get visible smoking on the touchlines of football matches or rugby matches when children are playing, or how do we get schools to think about smoke-free gates and thinking about enforcing those sorts of issues. It's not an easy thing to crack, and I think we've seen that with hospitals. I think hospitals have had a challenge in trying to address creating smoke-free environments in hospitals, and we tried lots of things in NUH. I know there's some great work around thinking about some really thinking out of the box around how can we prevent some smoking and trying to use things like the fruit and veg markets to displace smokers around sort of some of the main entrance areas and actually turn it into a positive health message. But there's lots of work to be done across the community, and a lot of listening to be done to understand the best way to integrate smoke-free spaces into our lives.
Yeah, that's true. It's always an important part of these strategies, isn't it, to listen to the community so that you do something that they want and that lands really well with the community. The other area you talked about was reducing the number of people smoking, and this feels again like more familiar ground for myself coming from a clinical background. Are we likely to see any changes or any innovations in that space? Anything that you can say about that part of the strategy?
Yeah, so as I mentioned earlier, we've got a provider at the moment. We've got GP Alliance providing Stubit service, which is a great service for those who are aged 12 plus who smoke, to get support for quitting smoking, and largely using really specialist trained staff to go through behavioural change techniques and help people move through those stages of change from being sort of contemplating that idea of giving up smoking all the way through to quitting. I think that's really important that those services continue to exist. And alongside the announcement for the increasing age of restriction around tobacco was announcement about potential for increased funding and investment in stop smoking services. So we will see investment in stop smoking services over the coming years, with dedicated money coming from government to help us do that. And it's really important because in a survey that we did fairly recently, going out into communities and sort of talking to smokers and non-smokers and others, is that amongst our smokers in the city, a huge proportion of them want to quit. They want to give up smoking. What was interesting that we found was that whilst loads of them want to give up smoking, I think it was around 70% wanted to quit smoking, there was a large proportion who couldn't actually see themselves as a non-smoker. Whilst they wanted to quit, they couldn't visualize actually being an ex-smoker and giving up cigarettes. And I think the more people we can help on that journey to becoming an ex-smoker and realizing that it's possible, the better. And there will be lots of innovation, and I know you're probably aware of a lot of it around the lung health checks and the work that we're doing around smoking there. That's really good.
Yeah, good. So that you were mentioning, a lot of people don't they want to quit, but they can't see themselves as ex-smokers, and that just takes me sort of back to the clinical room, really, or the consultation, because the clinicians out there, and the healthcare assistants, or anyone who has that one-on-one contact with citizens or patients, often feels a little bit demoralized around the issue of stopping smoking, because we often have quite a lot of conversations, but we don't always see that they result in stopping smoking in terms of those individual conversations that we have. I don't know, is there anything that you can say to either re-motivators or anything that that might be helpful for us to do in terms of structuring those conversations with people from a public health perspective, that might make us more impactful, or that might as I say, re-energize us in terms of having those conversations?
Yeah, so I think, so firstly, a thank you to those people that are having those conversations, because they really do matter. And I think we can talk about it at a population level, or we can talk about an individual level, because at a population level, it matters because, we know that the impacts on our health system of smoking, and the more people we can get to contemplate giving up smoking, the better. On an individual level, even getting one person to quit smoking has an impact on that individual's life, and their children's and their grandchildren's lives. So I think those conversations about smoking are really important. And the only thing I can encourage people is to have more of them. It may not be the first conversation that leads to someone contemplating quitting smoking. Again, the survey that we did talked to people about what really started them on their journey to quitting smoking. And while many people talked about the cost of smoking being a driver in their decision making to contemplate quitting, a lot of them talked about conversations with GPs about health conditions that were linked to smoking, and receiving that unwelcome news about changes in their health that actually prompted them to take action and take that final step between, they contemplated it before, but they've never really contacted the service and got involved, to going, actually, I'm going to take action. I'm going to chat to someone about this. I'm going to get some support to help. So I think that's a really important step.
Yeah, it's good to hear that those individual contacts matter. The way I often look at it is, I think, well, each individual contact adds up, over time. And if they hear the same thing from different professionals, I think that all adds up in their mind, moves them along that change cycle that we talk about, and eventually people are moved to the bit where they consider changing. And particularly if they have an event or something happens in the family, there's often an enhanced opportunity to have impact with the conversation there as well. And that's how I often look at it.
And I think we talked a little bit about what's to come in the future. And we're in the midst of a process to procure what we're calling an integrated wellbeing service. It will have a name in the future, but an integrated wellbeing service that brings together services around weight management, around smoking, around brief advice around alcohol and gambling. Bring those things together through one single point of access, and allow those conversations to have an impact. But also there'll be opportunities for training for staff around how to have those brief conversations, those healthy conversations with people about how do we have that sort of prompt with our patients to get them, what's the hook that they need, and how do we, because everyone has an individual hook. There's not one hook that I can tell you right now that will work for all your patients that you come into contact with, but actually there are individual hooks that we need to figure out how we identify and draw out of individuals to find out how they can make that move to quitting. And that service, I think, will be important. And it's as you say, midst of the program at the moment, due to launch April 2024. You'll hear lots more about it. You'll hear loads about it from I'd imagine January onwards. Conversations will start to take place. And it'll be about that conversation again that we talked about. How do we make sure that service works with, GPs and healthcare professionals to provide that feedback to you, to make sure you're hearing the stories about the difference that some of those referrals and conversations are having.
Good. So almost a good place to probably draw it to a close, David. I'm actually feeling more optimistic than I was at the start of this conversation about the future of smoking in Nottingham City. It's really good to hear about the Smoking and Tobacco Alliance. The strategy sounds, really really sound, and it sounds like partners are around the table and signed up in a way that they haven't been before, and supported by possible change in national legislation. So I'm feeling good. So you've had that impact on me, hopefully similar to people out there. David, last question that we're asking everyone in this this series of podcasts. What should people do next? And it might be related to the topic that you've talked about. It might be something completely different that you want to draw people's attention to, but what should people do next immediately after they finish listening?
Oh, immediately after they finish listening. All right. So, I think,
or later on. I'll give you a bit of freedom.
We can do both. It's fine. We can do both. So immediately after, I think is find out about Stubbit. Is go to GP Alliance website, find the Stubbit link, learn a little bit about the service, so that when you're chatting to patients, when you're chatting to people that come into contact with that smoke, you have that piece of information there to go, this is the service, this is the sort of thing it does, and this is where you go to find out about it. So I'd encourage people to go to the GP Alliance website and look at the Stubbit information that's on their website. And also, if they want to find out more about all those different areas that we've got in our strategy, the Healthy Nottingham website, www.healthynottingham.co.uk, is where the health and wellbeing strategy is host, and where the smoking and tobacco vision document and action plan is present. And there's some contact information in there as well that you'd be able to get in touch with members of the team if there are particular areas of that where you think you can have an impact and want to get involved working with us. Longer term, I think it comes back to what we're saying is keep having those conversations, keep talking to people about smoking, about the dangers of smoking. Remember it's an addiction, and that people need support to quit, and they are much more successful with that support to quit. So those conversations they take time, and they're sometimes hard, but they're valuable.
Yeah, thank you very much, David, and thanks very much for your time today. There's this and other conversations available on this YouTube channel or podcast link or wherever you're listening to, so hopefully dip into some of the other conversations, and thanks again for your time for listening out there. Thank you.
Cheers. David. Thanks very much. Thank you.
Bye.